I'm here with Dr. Kristin Moffitt, infectious disease specialist from Boston Children's Hospital, to talk about how she's partnered with Bright Horizons on health and safety protocols at our Bright Horizons centers across the country. Dr. Moffitt, thank you so much for joining us today.
Sure, thank you for having me.
To start, tell us a little bit about your expertise and how you've been partnering with us here at Bright Horizons.
So I take care of children with a wide array of infectious issues, and I am very involved, as is everyone in my division in the hospital, with all of the infection prevention and control practices that have been fine-tuned and implemented to prevent COVID-19 transmission in the healthcare setting. And I became involved with Bright Horizons relatively early on in the pandemic. So I started working with them in the context of developing protocols to put into place to try to keep teachers, staff, and children who were still working in and attending those centers as safe as possible during the course of the pandemic.
How would you answer a parent's top concern, which is, will my child be safe?
I think that it's, of course, it's a great question. It's a question that's going to be on every parent's mind. I would say for Bright Horizons, one of the really productive and positive impacts of those centers keeping some of their critical centers open throughout the duration of this pandemic to be able to provide services for healthcare workers and essential individuals and first responders is that these centers have already gained a lot of experience in enacting these protocols, in fine-tuning these protocols. So I think that Bright Horizons will have a jump start on what exactly it's going to look like to really expand these protocols to larger numbers of centers as they reopen.
Teachers and staff are obviously going to be receiving extensive training on these enhanced health and safety protocols, but would love just a quick summary from you. Tell us about these protocols. What do they look like?
One of the most important protocols that has been put into place and fine-tuned several times is the health screening that will be undertaken by all teachers, staff, and children, as well as families doing drop-off when they are even entering the center, so before they've even entered the center. And another important component of that screening includes questions that screen for anyone who might be ill with symptoms of COVID-19 or who's been diagnosed with COVID-19 within the household of those individuals. And then in addition to the health care, to the health screenings that everyone will undertake, some of the enhanced protocols that are in place within the centers include reduced group sizes. Additionally, there are enhanced protocols around hand hygiene, how frequently that should be undertaken, exactly how that should be undertaken. And then there are enhanced protocols in place as well for cleaning and decontamination of surfaces within the classroom or other surfaces that children and staff might be in touch with.
What's the basis for these protocols? Are they in line with things that are outlined by the CDC?
Very much so. So these protocols are always cross-referenced with the protocols that have been offered by the CDC. In addition to CDC guidance, a lot of states and state-level Department of Public Health and local departments of public health have offered guidance as well.
As these parents do return to care, any advice that you can give to help them prepare for these centers and new protocols?
I think if families are returning to care, if their child has not yet been exposed to the health screenings, for example, if the child has not yet had much experience, they have not been in a center since the pandemic began, and they don't really know what to expect in terms of how the center will look different and operate differently, and how children will be encouraged to keep more distance from other children. I think what families could start to do is to talk about that in age-appropriate terms with their child, talk about why, for example, example, the parent doing drop-off with that child is going to have to stop before they enter the building, and they're going to have to answer some questions. And the parent or the guardian doing drop-off is going to be wearing a mask, explaining why the teachers are going to be wearing masks, explaining why washing your hands before you touch your face is so important, explaining why avoiding touching your face to whatever extent is age appropriate would also be important. So starting to have those discussions on a child's level before entering the centers can be really helpful. And then again, depending on the age of the child, parents could start in the home setting, either in an indoor or outdoor setting, to develop some cues for what social distancing looks like, to really practice what approximately 6 feet of distance from another individual looks like, so that the child has some experience with those terms and has some experience with those expectations before re-entering the center.
Dr. Kristin Moffitt from Boston Children's Hospital, thank you so much for your time.
Sure. Thanks for having me.